On September 25, 2021, Allied Pacific IPA and Garfield Medical Center jointly sponsored a special continuing medical education program for primary care physicians at the Marriott Marquis San Diego Marina. This event was a welcome return to pre-COVID normalcy, allowing doctors to enjoy real interaction with colleagues and attend live face-to-face presentations. This opportunity to earn CME credit in beautiful San Diego, California, was moderated by Dr. Kenneth Sim, who serves as both chairman of Allied Pacific IPA and the chief of staff at Garfield Medical Center.
Well, I would like to welcome all of you, all the Allied Pacific providers, doctors, to our annual San Diego event, which is our providers event. The objectives, of course, of this event is to get everybody to come together. We spend some time, we get to know each other better. But the other main objective really this year is to share with all of the doctors and nurses and the health plans what we're trying to accomplish going forward for Allied Pacific IPA in the year 2022. So myself and my partners have determined and decided and totally committed to quality. So I define qualities in two ways. Number one is patients' ability to access their doctors. Number two, we want to make the patient's experience an outstanding experience for our patients.
This event was co-sponsored by Garfield Medical Center. In attendance was Garfield Medical Center's CEO, Herbert Villafuerte.
Hello, it is a pleasure for Garfield Medical Center to be part of this continuing medical education symposium. It is through a continuous partnership between hospital, IPA, and the community to be able to improve the access for our patients to services that are normally done in academic organizations. As you can see today, the various presenters have clinical expertise in different areas that are now available at Garfield Medical Center. I want to thank Allied Pacific as well as the Garfield Medical staff and also AHMC for the opportunity to participate in this great event. Thank you.
Dr. Casey Tan, Director of Neurovascular Services at Garfield Medical Center. Dr. Tan addressed concerns related to surgery performed under critical environment conditions, vascular care, and the improving long-term outcomes of neuroendovascular surgery.
Hi everyone, my name is Dr. Casey Tan. We are here to celebrate the Garfield Medical Center and Allied Pacific Medical event. We are here to honor the advances in healthcare. We just had a symposium. It was very successful, and I'm looking forward to serving all of you in the community and seeing all of you in our medical practice very soon. Our healthcare city is coming, and I'm very excited to see what that unfolds for everyone. Thank you.
Dr. Rick Van Etten, Director at UCI Health Chow Family Comprehensive Cancer Center.
Today, I talked to the CME group about screening and prevention of liver cancer, specifically why liver cancer is such an increasing problem, the current recommendations for screening for this disease, the fact that surveillance and screening can detect early cancers and prolong survival. Then I talked about the problems with current surveillance technology, the limitations in particular of ultrasound for screening for hepatocellular carcinoma, and the potential value of new blood-based tests for detecting HCC. And then lastly, I talked specifically about a test called the Helio liver test, which is a blood-based test that combines methylation patterns in cell-free circulating tumor DNA together with some protein markers. And I showed that it had superior specificity and sensitivity to ultrasound and AFP and potential applications in a general medical practice for detecting liver cancer early, allowing earlier diagnosis and intervention with treatments that are potentially curative and also potentially reducing the cost of care.
Dr. Nick Kwan, the Medical Director of San Gabriel Valley Medical Center.
So I'm here at the Allied Physician Retreat, and I had the honor and the pleasure of speaking about connecting our community and our members and our patients to emergency service and the up-and-coming super urgent care centers. I hope this will greatly benefit our patients and our community in the future.
Dr. Anand Annamalai, Director of Organ Transplant and Cancer Surgery with House Medicine.
Today I had the pleasure of speaking about vertical integration in healthcare. It's a very important concept in our healthcare landscape today. Hopefully this will be able to bridge care and access and equity gaps in the community setting. And we're really excited to be able to bring this model into the community where we align professionals, management, and hospital facilities in order to better care for patients in our community that have complex diseases.
Dr. Carolyn Yao, pediatric plastic surgeon and assistant director of the Cleft Lip and Palate Program at Shriners Hospital for Children, Los Angeles.
I'm here at the Allied Pacific Conference discussing the medical needs for plastic surgery. Most people don't think of plastic surgery as a medical need, so today I spoke to the audience about different diseases and ailments that children and adolescents may have. This includes cleft lip and palate, burns, scars, keloids, and ear deformities.
This is a great opportunity for a lot of our physicians and also specialties and invited guests to come to San Diego for this conference. And this is a great time of the year, particularly this is after COVID-19, where we can get together and share the latest knowledge and understanding of medicine.
Dr. Andrew Chen, board certified in internal medicine, cardiovascular disease, and echocardiography.
I just gave a brief overview of EP and everything that EP offers. This goes from non-invasive management in the clinic to ablations and the placement of implantable cardiac devices.
Dr. Peter Xu, board certified in internal medicine, cardiac CT, echocardiography, and nuclear cardiology.
Today I talked about echocardiography and its utilization and wide scope of use in assessing cardiac function and in treating cardiac diseases from ischemic heart disease to heart failure to myocarditis, and aiding interventions for our interventionists as well as electrophysiologists.
Dr. Shun T. Kerr, clinical professor of surgery at Keck School of Medicine, University of Southern California.
I made two presentations today. First one was the common anorectal disorders. Second presentation is entitled Screening and Surveillance of Colon and Rectal Cancer.
Yeah, Allied Pacific has a very great event today. We want to thank our outstanding speakers covering a lot of topics about health delivery and some of this new technology, taking care of difficult issues. And the presentations are very insightful and very educational. And also, it's good to have our providers getting together here in San Diego. Hopefully that the pandemic is improving. So we are very, very happy about the activities that are being taking place in San Diego, and we are looking forward to continue to serve our community with a focus on quality and integration.
Myself and my partners have determined and decided and totally committed to quality. To summarize, quality is job number one at Allied Pacific IPA, and quality means access to your doctors and experience thereafter. And we promise and we are committed to giving you the best possible care that we can muster.
Congratulations to Allied Pacific IPA and Garfield Medical Center for successfully sponsoring this continuing medical education program. We look forward to many such events in the years ahead.